Good morning, everyone. Make yourself comfortable. Welcome to this first webinar here for Latin America and the Caribbean. This is being hosted by the Global Health Network and MESH. We're going to wait a couple minutes before everyone joins in. Give everyone some time. We're going to have some very enlightening talks today. They will be about community engagement in Latin America and the Caribbean. As you may all know, these are all very diverse and important, not just for the Latin American communities, but for the globe as a whole. Today, we'll be talking about how to involve communities in health research, basically, so that these can be made more sustainable, equitable, and how they can engage communities a bit more. All right. Let's start with the housekeeping. This webinar will be recorded and shared on the Global Health Network page. It will be held in Portuguese and Spanish, and we have simultaneous translation available. This is where you can find the interpretation button. Through it, you can choose the language of your choice to hear the webinar. Due to the number of participants, your camera and microphone will be disabled. Please use the chat to contribute to the webinar. Also use it to contact us should you have any technical issues. You can also use the Q&A button to send in your questions. This can be done at any time, but the questions will be addressed at the end of the session. So as a first order of agenda, I'm going to introduce myself. My name is Luis Felipe Arias Soto. I'm from the Global Health Network. I'm the Regional Community Engagement Coordinator for MESH. We are going to hear about experiences of community engagement in Colombia. That will be addressed by Professor Fabian Méndez from the Universidad del Valle in Colombia. We're also going to hear from experiences of community engagement from Mr. Guzman, as well as from experiences from Brazil with Mr. Cristofani from Fiocruz, Brazil. After that, we'll have some time to answer questions. So please stick around to the end. Thank you so much for your interest in this webinar. This is where you can see a graph with the participation for today. These are the people who are registered for the webinar. Most of them hail from Latin America. Understandable, as it is the main topic today, but we also have many other countries participating. This is a global webinar. Hopefully, there will be many chances for exchanging experiences to a wider audience, that is, not just from Latin American community. All right, welcome all. My name is Luis Felipe Arias Soto. I'm the Region Community Engagement Coordinator. So let's start talking about the network. This webinar was used as the launch of the MESH network for social participation and investigation by the Global Health Network in Latin America and the Caribbean. We also have participation in Africa and Asia. And now we are launching this program in Latin America. This is a continent with great cultural wealth. I hail from the Dominican Republic, and I'm fully available to all of you. So let's start talking about what social participation is. We have various terms in Spanish that we use for this concept. So community participation, community engagement, participative science, social participation itself. Although we have many concepts, social participation is an umbrella term, and it is used largely to define community engagement in research. We have a series of experiences based on social participation in research, and MESH's mission is to collate all of these experiences and disseminate them. This all depends on its members in order to inform the network for the benefit of the entire region. So what can MESH offer? It is basically a platform through which you can have access to a variety of resources. There are guides, manuals, all for community engagement. Of course, that's in English. We are acquiring funding to try to contextualize it in Spanish, all to try and share more experiences in community engagement, so that any and all researcher will be able to share their experiences and benefit from the experiences of others. They will also be able to place themselves in a specialist map so that they can be considered a local specialist. This MASH map already exists, and people have the opportunity to appear on this map so that any researcher or even funding agency can find them and become aware of who are the local specialists in that field. That also facilitates networking. This is something that we really stimulate. This is a screenshot of the page. This is the Latin American and the Caribbean section. We have translation for Portuguese. Here you can find a few articles, links to webinars, courses, a map of Mexico. And anyone who works in these fields will be able to have access to that platform. Aquí también ponemos un código QR y enlace a la página de Latinoamérica y Caribe, de MESH. These are some links through which you can get in touch for MESH and for myself. If you wish to disseminate your work or your reports or contribute in really any way, please do get in touch. So now I will pass the floor to Professor Fabian, who will be talking about the Colombian experiences in community engagement. He's a professor from Universidad del Valle. He has a PhD in epidemiology and is focused on studies of the environment. He's a researcher for more than 20 years in topics of epidemiology, environmental justice, and the effects of environmental pollution on vulnerable populations. His projects incorporate processes of social participation with the involvement of groups and social actors and seek to influence public policies. I will now pass the floor to him. Good morning, everyone. Just a moment while I share my presentation. All right. Thank you so much to the MESH Network for the invitation. The project I'll be talking about today is basically an experience in social participation. Its title is One Amazon, or buildings socially based health in rural populations. There were many goals in this project. But the main proposal was to really assess how the pandemic affected these communities that live largely in the Amazon region. The project was developed not just in Colombia, but also in Peru and Ecuador.
Pero yo hoy voy a enfocarme un poco más en los resultados de Colombia y en particular de un sector de Colombia.
I'll be focusing on the results, and especially in one area within Colombia. So our intention in these communities was to describe how these communities organized faced with the pandemic. We
pensando
must
en futuras
understand and
pandemias
strengthen
y
that
todo esto dentro de
collective
una
capacity,
preocupación de la
especially
salud.
in the light of the possibility of
Em,
future pandemics.
Muy importante dedicar un poquito de tiempo a qué es lo que entendemos por One
Another thing
Health o
that's very
One
important
Health
for us to understand
en
is
inglés.
the time and
Esta es
how
una
we
aproximación
understand the
muy
concept of
conocida
One
por
Health.
muchos de ustedes para explicar
This
y
is an
comprender y
approximation
actuar
that's
en salud,
very familiar to many of
entendiendo
you,
que
I'm
los ocho
sure,
ecosistemas están
to
integrados y
comprehend and
que
act in
salud
health,
humana no puede
understanding that
desligarse de salud
social
animal ni
ecosystems are
necesariamente de
integrated
todo.
and human health cannot be
Esto
isolated
parte de
from
entender
animal and
además
ecosystem
de
health.
pararnos en que los sistemas sociales
And
y
for that,
ecológicos están
we must also understand that
inextricablemente
social and
integrados
ecological
y que para
systems
eso
are
necesitamos
completely
conocimientos
integrated,
tanto
and their
científicos
analysis
comunitarios
requires
y además
scientific and community-based
debo
knowledge.
aclarar que en nuestra investigación entonces se para desde una base participativa
Here, I must
llamamos
also clarify
investigación de
that
acción
um,
participativa, combinando métodos
we have
cuantitativos y
participative
cualitativos, donde
action,
los
which
investigadores
combines
no
quantitative and
solamente está
qualitative methods,
constituido por un
which are
equipo
developed in an
interdisciplinario, sino
interdisciplinary
además por
way by
co-investigadores,
community
co-voluntarios.
co-researchers.
Precisamente, un ejemplo de cómo concebimos esta investigación está en que antes de empezar el
An
proyecto o en las
example of
fases
how
iniciales del
we
proyecto,
conceived this piece of
construimos esta
research
gráfica que ven aquí.
was
Es
that
una
before
línea
the project, we built this graph. It's
construida
basically
con
a timeline.
líderes y lideresas comunitarios que
This
muestra
was built
al
in
momento cuando
partnership with
llegamos
community
nosotros al
leaders.
proyecto la historia del territorio. En este caso es un municipio
It shows the
Caquetá, en el
history
área
of
del
this
Amazonas donde
movement
estábamos
ever
trabajando,
since the day it
que
started.
nos muestra pues desde la década del 50
This
cómo
is a
este
municipality in
territorio
the area
sufrió
of the
mucho
Amazon.
cuidado. No voy a
And since the
detenerme en los
50s,
detalles, pero aquí lo que
it
queremos
shows
es
how
enfatizar
this
la
territory
relevancia de
developed.
entender de
I won't
cómo
go into too much
textualizar
detail.
la investigación
I
que
just wanted to show
hacemos,
the
comprendiendo
relevance
cómo se
of
fueron
contextualizing
conformando los sistemas
research.
alimentarios, el sistema de salud
This is essential
y
for the
todos los
understanding of
procesos de
how the
organización social
food and
en
health
este
systems
territorio.
have been set up
¿Qué
in this
hicimos en
territory.
particular? Pues hicimos investigación, acción
So what did we do?
participativa. No voy a detenerme a
We
mostrar
conducted
detalles de cada
participative
uno de estos
research.
elementos de la
I also won't go
investigación,
into too much
pero sí quiero hacer
detail for
un
each one of these research
rápido
elements.
cubrimiento de los
What I would like to
principales
do
temas y
is
hallazgos alrededor de lo que fue la
cover the
participación
main
en la maqueta
themes and
colombiana y en
findings,
particular en los
especially
departamentos de Caquetá y
to show
Amazonas,
you how
por
this
cómo
was
está
developed,
organizado el sistema de
how
salud
how
en estos
COVID
pueblos,
was
las
faced
relaciones
in
entre
this
empresa y
region.
salud, un asunto fundamental en nuestra
What
investigación, la
are the
alimentación, la
workings of
seguridad
the
y la
health
diversidad
systems in these
alimentaria
regions?
y asuntos de agua y saneamiento que también investigamos de manera participativa.
Food
Luego voy a
security, food
profundizar un
sovereignty,
poquito
water
más
and
en un
sanitation are
proceso
all elements.
formativo, un proceso de formación comunitaria y terminaré con unas rápidas
Then we'll talk about community
afirmaciones o
training,
conclusiones alrededor de lo que es la
and then I will
apropiación
talk
social
about
de
the
conocimientos y de
findings
experiencia
themselves and
política.
social appropriation of the
Para empezar
project.
entonces en los resultados, pues
All right,
el
so let's get
COVID-19 en
started
la
with the
Amazonía colombiana
findings.
tuvo un primer pico de casos muy grande en el departamento del
We had
Amazonas.
the first case
Leticia, que
peak
es la
for
capital del
COVID-19
departamento, tuvo
in
una
the
crisis muy aguda
in
desde el
early
2014 y desde el
2020.
2020. Leticia tiene un aeropuerto
We are all aware
internacional
of the
y
crisis that
esto
the world
hace
went
muy
through.
fácil que hayan llegado
This
casos
region has an international
directamente a
airport,
esta ciudad. Todo el
which made it
turismo
especially easy
ambiental que se
for
produce
the region to
y que tiene
become
un
victim
aeropuerto.
of COVID-19.
Nosotros, a partir también de métodos cualitativos y hablando con líderes y lideresas comunitarios,
Based on
pudimos
qualitative
identificar con
methods
base en
and
reportes
talking with
orales
community
una
leaders,
temprana ocurrencia de algunos casos
also
probables
based on
tan
these
temprano como
reports,
el
we were able to
2019.
identify
Los
that
sabedores indígenas nos dijeron,
um,
aquí tuvimos
we had
enfermedades que nosotros
cases
por
as
nuestra
far
tradición
back
no
as
podíamos intervenir
2019,
y
as
que
late
empezamos a
2019.
reportar y a mandar al sistema occidental de salud desde finales del 2019.
This started
Lo
being
que queremos
reported at the
enfatizar
end
es
of
que
2019.
durante el 2020 esta fue una
What I
frontera
want to emphasize is that
muy
all
porosa,
throughout 2020,
eh, pasa gente de
this
Brasil,
was a
Perú
very
y Colombia de manera muy
um, a
fácil
very
y hubo
busy
una alta
border
incidencia y
region.
un hallazgo importante es que las
People
medidas que hemos
go from
implementado
Brazil
desde la
to
Organización
Colombia,
Mundial
from
de la
Colombia
Salud
to
han
Brazil very
podido
easily.
funcionar.
And one important finding is that
Construimos un dashboard
containment barriers and measures in general were not well implemented.
de acceso comunitario para que la gente vea dónde y cómo ocurrió la pandemia, dónde
This
ocurrieron
is
más
publicly
casos
available
y
information
menos
here
casos.
so
En
that we can
general,
see where
y para
are
terminar esta
the
primera parte,
highest incidence of
COVID-19 en la
cases.
Amazonía representó para las comunidades
And just finish the first part.
un problema, como ellos lo describen en muchas de estas comunidades, especialmente las comunidades
COVID-19 was a
indígenas,
very large
no
issue for these
viviendo en
communities,
centros urbanos poblados como algo lejano. Y fue algo
especially
percibido
for the
más con
populations that
desconfianza,
don't live
con
in urban
incredulidad,
centers.
en
To
general
them, it
una
was seen
percepción
as
baja del
an
riesgo de
issue of the
enfermedad.
centers.
En el contexto de Colombia es
There was a
particular
very
porque
low
Colombia en
risk
proceso de
perception by these
posacuerdo
communities.
después de la
And in the
firma del
Colombian
acuerdo
context,
de paz con la
especially,
guerrilla. Sin embargo, este conflicto armado se resiste a dejar nuestro
there
territorio
was a signing of a
independiente
peace treaty with the
y durante la
guerrillas.
pandemia hubo una
It
profundización de
continues.
algunas políticas
And
extractivistas.
during the
De hecho, pues
pandemic,
la
some
deforestación aumentó
extractivist
durante la pandemia, en
policies
parte por el
were
debilitamiento de muchos servicios esenciales,
potentialized.
no solo los de salud, sino de conservación a nivel rural. Una baja adherencia a medidas preventivas. Nosotros
Many
estamos
health
positivos de
services were
mostrar
degraded,
una
and there
una
was
tercera
very
parte de
low
la pandemia
adherence
estaba
to
más
preventive
asegurada
measures.
y lo que sí fue muy efectivo, de acuerdo a lo
Only a
que
third
los
of the
documentos
families
nos
were
fueron mostrando,
vaccinated.
fueron unos procesos de construir unos cercos para aislar a las comunidades. Tenemos un sistema de salud fragmentado, con un sistema de
We have
aseguramiento
we
que
have a
dificulta la
fragmentation
distribución de recursos y
of
esto lo
the
pudimos analizar.
sanitation,
Este es el mapa de la
and we have been able to
distribución de
analyze
recursos.
that. We have a
Estamos
map
muy
here to
concentrados en
clarify
servicios
that.
de salud en algunos
You can
municipios. El
see the
mapa de abajo a la
concentration
izquierda muestra
of
dónde
health
sistema de
services
cuidado intensivo solamente
in some
tres
specific
centros y
municipalities.
el mapa de abajo a la
Here we
izquierda
have solo
dos,
ICUs
tres municipios de toda la
shown
Amazonía.
in the left-hand map
Nosotros,
in a couple of
trabajamos
municipalities
continuamente
across the
y
Amazon,
caracterizamos la relación entre
Colombian
ambiente y
Amazon.
salud
Now,
mirando
moving on to
los
another
planes nacionales de
component, we have
desarrollo y cómo se
characterized the
construye
health
salud de una
environments,
comunidad,
analyzing the national
qué
development
impacto
plans as
produce en los
if,
campesinos.
or
Un
as this
hallazgo
adherence is constructed.
concluyente es que
There's
hay
also the
un choque,
movement
hay una
of the
disputa allí entre
peasant movements.
las formas de
The issue is
relacionarse de
there
la
is
comunidad.
dispute
Me refiero a comunidades
between the
campesinas
way communities
indígenas,
relate,
cómo ellas se relacionan con su
the
territorio y
peasant,
también con sus
Afro-Indigenous peasant
diferentes
communities and how
relacionamientos con
they
su
relate to their
territorio y
territories,
cómo pues la visión de desarrollo
meaning
entiende
the
lo que es el
relational
desarrollo.
ontologies and their
Nos
developed
interesa,
views,
además de
as
entender
well as
esto,
the views of
revisar con
on the
retroceso
Amazon. In addition
las teorías
to
que
that
muestran que
understanding,
ese
we have to
choque
consider
entre
about the
presión
risks of
ambiental, como muestra
pandemics.
este mapa,
This
Soto, que
shows that
refería
this
a
clash
la
between
expansión
environmental
de la
pressure
frontera
is shown in
ganadera,
this map.
de la
That's why I would like to
extracción
make
minera.
reference to the expanding
Este mapa, entre
frontier.
más rojo, verde, significa que no hay procesos, digamos, expansivos y hay conservación
So you
ambiental.
see
Naranja, amarillo, rojo
the
significa
green area. There's no
conservación
expansive
ambiental.
processes.
Esta
That's
es una
why
de las
the
principales
orange,
fuentes de
the
contacto
red
entre
show
humanos
greater
y
environmental pressure.
vida
This is a
silvestre
major source of
y
contact
además con
among
ingreso de
human
ganado,
beings
lo
and
cual puede llevar
wildlife.
a el riesgo de
And what
pandemias
can
por los fenómenos de spillover, de saltos
what
de
else is
animales
affected by the
a humanos.
agricultural
Entonces,
business,
además,
and that may lead to
hicimos un
epidemics.
mapa indicativo de biodiversidad. Las zonas más verdes aquí
So we
indican
include
las áreas donde hay más biodiversidad y
map
lo que hicimos
indicating
fue
the biodiversity. So
sobreponer
the areas
estos
that
mapas
there's more
para construir
biodiversity.
escenarios de
Purpose is to
riesgo de pandemias o
overlap
zoonosis.
these maps with
En
different information
alimentación,
so we can build
hicimos una
different
encuesta
scenarios
sobre
concerning the
seguridad
COVID
alimentaria
pandemic.
con
And
participación de
food-wise,
profesionales.
we have just
Ellos nos
made this
acompañaron,
survey
ayudaron
about
también a
food
construir
security
la
with the
encuesta
participation
y
of
nos dijeron cómo y
co-investigators.
por qué
We have
preguntar y
now
algunas
put
cosas que hay que
together this
preguntar para ganar
survey
confianza. Finalmente
to
encontramos que el
also
77% de los hogares
ask a few
tenían
questions
asegurado la seguridad
concerning
alimentaria y como
observations that have been made.
inseguridad
So we have
alimentaria
found
son moderadas
that
y severas en estos hogares, en
77% of the
20% en
households
estos dos
had
municipios.
some level of food
Como
insecurity.
la seguridad alimentaria consideramos es
Very
un
well.
concepto
As a final
que
conclusion,
requiere para
we
realmente
considered
generar
food
resiliencia y
security
postura para
as a
que la
concept that
alimentación,
requires
su expansión a un
future
concepto mucho
resilience
más
so that we
fuerte de
have
base comunitaria como la
better
soberanía alimentar,
food
porque da
intake
cuenta de
on more consolidated concepts and with the food sovereignty within the process of autonomy. We have looked into 5 different lines of access to food sources. Also, access to food and agricultural safety, security. So involving the commercialization and food consumption with the rights to agricultural organizations. So we developed detailed research. And we have a few charts showing the different pillars and how access to these pillars go in terms of food security. We're now going to go to water and sanitation. In brief words, this is how the way that households in those municipalities are accessible to human beings concerning the microbiological assessment, showing the presence of contamination. There was no pesticides nor mercury in the water nor on fish. Also, community monitors have shown how consumption goes in schools and households. So we can have community monitors in order to be able to assess water quality. Now, basically, we have put together with the communities, we have developed this training strategy which involves community participation. So it's a training course, and basically we're looking at strengthening previous knowledge and other new knowledge that's acquired on the basis of science in order to generate knowledge around rural health and community health that will help empower those communities, that will involve academic players. These is these courses have contributed to strengthening or increasing community skills, such as strengthening the ensured women participation, as well as strengthening children's care, as well as to strengthen general outlook in order to have access to the different community members to these methodologies within the training program so we can build this knowledge. And in closing, I'd like to add that our project also includes social appropriation of knowledge and political advocacy. We know that everything we do is planning on the basis of developing community knowledge. The main purpose is to transform and strengthen these community organizations. I have participated in different stages of this project. So I'd like to show a brief example. We have put together a written material, basically implementing research strategies from community sources who have attended these trainings. So those community leadership have taken photos of the plants and plant life in general that allows us to show how these plants can be used, working with the communities. My conclusions include the following items. The pandemic, COVID-19 pandemic has affected Amazonian communities in different manners. So future pandemics are directly related to food security, and that has to be a crucial part of developing research in order to benefit transformations across this territory. And we understand that social participation is crucial. Also, it is a crucial part of our planning, basically because the final purpose of our research is exactly that. So I'd like to express my gratitude to the communities, to the participating communities, and this type of project.
movilizarse en
And
estos territorios.
we have seen the difficulty of implementing or engaging this mobilization. In this photo, we see how what the efforts were taken in order to achieve our purposes. And that brings my presentation to the end.
Luis Felipe, no te escucho muy bien.
We cannot hear you so well, Luis Felipe.
Creo que tu micrófono está abierto o está cerrado.
I think your microphone is not on. Okay, yeah. Can you hear me now? Yes, a little better now. We will now move to Professor Julio Canario, who's going to tell us about the experience in social participation. Dr. Canario, you have the floor, please. Do we have any problem with translation? Okay. Okay. As a clinical psychologist, some master's degrees in bioethics. He's got training in public health and bioethics. He is the founder of the Ethics Foundation in the Dominican Republic, and he is a PhD in telepsychology. So, Dr. Julio Canario, you have the floor. Thank you very much, Luis Felipe. Thanks for the introduction. I'd like to congratulate all of you who have connected with us here in America, in the Americas, and in Europe, and in Asia, and in Africa. So the very best regards to all of you. So let's start by talking a little bit about social participation experiences we have in the Dominican Republic and in the Ethicos Foundation. We have to involve the communities in this investigation, health investigation. This is crucial so that we can ensure the highest ethical standards. Otherwise, sustainability of those actions and the results would be affected. Also, the objective is to share the benefits coming out of this investigation. That's a crucial theme that we are always seeking to achieve. Also, as our research duties, we have to look about all of the aspects of the investigation, particularly that the investigator is engaged with these communities, and the purpose is to build empowerment, the community around the investigation or the research effort. So that project becomes a part and parcel of our research project when we work with the communities. We're now going to share this case of social participation in a project that is called E-DOT. It's a short name for the project. That project is intended to develop, to implement a mobile application in order to improve the outcomes of tuberculosis patients in Dominican Republic, not only in the Dominican Republic, but in all other countries of Latin America, because there's an epidemic, a silent epidemic, such as tuberculosis. Therefore, we have this stigma around the condition of this severe condition. There is obviously innovations around this theme, relying on mobile technologies. So much so that there's a group of researchers which I have had the pleasure of leading this type of research, looking at developing digital technology that will be able to work with these conditions. This project was divided into two phases. We've been working since 2019, and the conclusion in the second phase is scheduled to come to the end at the end of this year, 2024. So the result, the outcome is going to be a mobile application. As you see, it's going to be relying on the digital technology. All of us have a mobile devices, and tuberculosis patients in Dominican Republic, a good proportion of those patients will also have access to that technology. So we have more than 95% of the population who have access to the internet and to smartphones as well. So we saw that this could be a very good strategy in order to design this mobile application for that purpose. So since the beginning of the study, we were looking at social participation. And what was it in this research project? So we had focal groups involving the health personnel, focal groups with patients and with health professionals, that is, and we engaged in conversations with those groups in a very broad manner. So we made some surveys in terms of acceptability and usability of the digital tools. And we also looked at the stigma associated to the condition. So those people would have to be using the digital technology both at home and in their workplace. So we had to include, first and foremost, the issue of confidentiality and appropriate use of a digital tool. So we worked on that theme. We implemented a prototype of the application, and then we looked into the usability of that application. What were the outcomes of this initial moment? Well, the outcome of the studies have fed or have contributed to the design of the application. We were looking at doubts and the questions that would be asked by the users who were under those conditions, but we also considered the health professionals to look at the best functionalities for that application. After this investigation, we should be looking at the best capacity building for health professionals who would be using this mobile applications.
So what was the second stage? A work of consultation with patients and health personnel. During the study, we established in-person visits as well as online. During community engagement, it's very important to think about people who are going to implement these actions, not just the people who are going to be there providing the service. In our case, we also visited the TB units to directly observe how this work was developed. We met with the program directors for the National TB program, and their commitment was made very clear. We conducted meetings with patients, with patient associations, all for TB, of course. That relationship was established and it was quite fruitful. There are quite a few TB associations, actually. And it has been some time that we have been developing these relationships. With all of these elements established, we're able to assess our communication techniques for the objective of community engagement. So during the study, which community engagement elements did we prioritize? We saw the need of changing some app functionality and make it so a few of them could be used without direct connection with the internet. It was clear very quickly that this would be a need. These are known as offline functions. We were able to realize this through the exchange with the patients. They made it very clear that this would be important for us, for them. They could connect to the internet at one point, download some of the functionalities, and use them later when they were offline. There was also a bringing up of a new objective for the project. This was realized during the pilot session. The integration of the app with the existing digital infrastructure present in the public sector. The public reports from the National Health Service saw the importance of integrating it to the public sector. The project had advanced through the design processes. It had been through validation. And so the public sector already started requesting the integration of the app due to its importance. Of course, this requires further collaboration and exchanges with the public sector for education, training, and development, of course, so that the app could be disseminated to the degree that it would be ideal for the public sector's objectives. A third one was the improvement of the digital infrastructure in a few health centers so that they can be used efficiently during the phase 1 and 2 of the project. So we are currently finalizing the study. We had technical meetings with the participation of specialists, governmental bodies, and patient associations. This is also joined by international consultants who help us in the designing of the app. We were able to also continue our relationships with the health authorities in order to address the future of the app so that it can reach as many people as possible. The public sector's help is really essential for us to disseminate it to the population of the Dominican Republic. We've been facilitating the relationship between the various actors of the project. In the outset of the project, the objectives was not as clear as they became when the patient exchanges were established. Identified a need for a digital agenda, which includes a tool integration protocol for the public health sector in the Dominican Republic. This was crucially important. The outreach of the digital agenda has made it possible for us to work with these various app protocols. The National Health Services had a few standards that we needed to meet, and they basically became the funding agent for the project. That also included the National Health Research Center. These were key players for the study, and we're able to all work together very fruitfully. This is what we realize that it is very important to involve the stakeholders as early as possible in order to develop digital tools that intend to improve public health. Involve the people who are affected by that health condition. That is essential. And continue to improve the planning and the execution of investigation projects. This is all for the EDOS case. It's a very innovative initiative. Éticos has been hard at work for it. This is another initiative called Éticos en la Comunidad, or Éticos in the Community. It's a community engagement initiative in non-metropolitan regions. It is a way for us to understand the power and really need for us investigators to be present in communities before starting investigation projects. For that, we can recruit community agents who live in these zones and who already have experiences talking about working with rather NGOs, universities, and various agencies. These people who already know their communities can serve as intermediaries between the Ethicos Foundation and the communities involved. These can help us contact neighbors, inhabitants, local leaders, all of these in various sectors, of course. This can also include the press, which can help us to disseminate the message of the work. We must also coordinate neighborly meetings in order to talk about our community strategies in the community. So what is the methodology? This is very sensitive. In these meetings, we discuss the various needs of the community. We listen. We also express what Ethicos is about, what is our experiences, and how we can best align, basically. What are the roles that mesh and the agency can play in that location? This can help them learn more about various themes. We propose a very transparent dialogue with the communities, communicating the capacities and limitations of the institution. So why do we do it? We do it because Ethicos understands it has a firm belief in community engagement in order to enact change and promote sustainability for any action that promotes the public good. We are willing to work from the earliest stages with populations. We have various active research projects going on, and many which are planned. These institutions have to be willing to give and not just receive. And know that you are playing a role of a small grain of sand in a wider community that has a context that you are now becoming a part of. This is just an overview of these social engagement activities that we have going on in Ethicos right now. I'm available for questions later.
Muchísimas gracias, doctor Canario, por su presentación. Una vez más, vemos otro ejemplo de participación social y podemos ir viendo la diferencia que hay entre diferentes países en el continente latinoamericano.
So we see
Ahora,
the
en ese mismo
difference of
orden,
social engagement, and
continuaremos con
we
nuestro
see the
siguiente
difference
expositor,
in
Giorgio
different
Garcia Cristofani,
countries
de Brasil, de Fiocruz.
of Latin America. Now we're going to have
Giorgio
the
es,
Professor
tiene
Cristofani
una
from
maestría,
Brazil,
licenciatura y maestría en
Giorgio
Estudios
Garcia
Internacionales
Cristofani from
por la
Brazil.
Universidad Pontífica Católica de Río de
Has
Janeiro.
got a diploma from the Catholic
Desde
University in Rio de
2022
Janeiro.
es investigador y coordinador de
Since
participación comunitaria de proyectos de
1922,
investigación, conexión de salud,
2022,
sin
he's been an
relacionado con
investigator in
pueblos
health
indígenas en la
conditions
Amazonía,
and
por la Fundación
participating in
Fiocruz,
the indigenous
en colaboración con el
laboratory
Ministerio
in
de
the
Salud
Amazon,
de Brasil.
and communication with health
Es
ministry
miembro
and
del grupo de investigación
health.
política y
He's a
global de
member of
pueblos
the
indígenas.
political
Su trabajo se centra
investigation
principalmente en la
center for
investigación
the indigenous
participativa y
people,
comunitaria,
focused on
compromisos éticos en
participatory and
investigaciones
community
con pueblos
investigation,
indígenas,
uh,
interculturalidad y
doing
salud
in
indígena, enfoques antropológicos y
investigation
de
in
participación comunitaria y
indigenous
desarrollo rural.
health and community conditions.
Giorgio, ahora puedes continuar con tu presentación, por favor.
So please, you have the floor, Professor Giorgio. Thank you very much. Thank you, Luigi. I'm going to start my presentation now. This presentation is written in English, but I'm going to be presenting that in Portuguese. So I hope translation service is working. The title of that presentation is called Community Engagement Approach in Vulnerabilized Territories, Vulnerable Territories. We understand vulnerable as the more correct term because they are not exactly vulnerable, but they are in a situation of vulnerability. So we have chosen to use the word vulnerabilized. So as far as the introduction goes, my presentation is going to be divided into 3 parts. I'm going to be addressing community engagement experience during the pandemic crisis, the COVID-19, in the periphery region of the city of Rio de Janeiro called Favela da Maré, the Maré community, the Maré favela. Then I'm going to be talking about this community engagement in the indigenous territory in Xingu. That's where I coordinate the community engagement project. I've been working there since 2020. But after that, I have come closer as a main investigator in this health project in connection to the project of indigenous peoples and to Fiocruz. And lastly, we're going to be talking about some conclusions that have come out after those experiences. Some initial assumptions. What we have perceived is that since the COVID-19 pandemic, we know that the success in dealing with epidemics and with whatever health surge is to have a strong community participation and a community base. So the success in dealing with any health program has to do with the level of community engagement and equality, as well as trust among the relationships of the main health and community players. Like any community engagement project connected to urban or non-urban communities, that depends on much greater responsibility on the part of the researchers and investigators in general. There's this bond of trust, and there's got to be a very strong bond with the communities. So this research is rather different from traditional research. It relies on citizenship science, participatory science, as well as on responsibility. And lastly, we have been working with the idea of data for action, meaning all of the research, all of the data that has been assessed, all of the research parts need to have an impact on the community roles. So community engagement is not only a matter of people, it also has to generate impacts far beyond research papers. It needs to have social impacts throughout the research effort. So the initial context is the Maré favela, which is a large favela in Rio de Janeiro, including 140,000 inhabitants, a complex of 16 favelas and the periphery of Rio de Janeiro. During the COVID-19 pandemic, we know favelas were the places with the worst death and infectious rates. However, the community engagement project presented excellent rates even during the crisis. The first action is connected to Fabiano's presentation, which is during a pandemic, during a sanitary crisis in a vulnerabilized area, the first thing is to ensure food security. Food security in an extremely poor area of the city of Rio de Janeiro in Brazil, to justify people staying home, not leaving home. To justify those research efforts, we needed to identify who was the most vulnerable people during the COVID-19 pandemic, and to ensure they had enough food and water. Based on that, we created the community kitchens, which was a period in which, at the same time we ensured food security, we would enforce that health information was being shared and vulnerabilities were being mapped. I think there's also an extremely valid experience coming out of this experience, which is Romário, an individual from the community. He started helping us in the distribution of food, and he later became the favela's community engagement coordinator, and is now a member of a health data team. And this is an example of how community engagement started from the bottom up and has been able to include a favela resident during the COVID-19 pandemic with information and participation until he became a crucial part of this data assessment community. A major issue that comprises all of the community engagement cases is the network effort, which will have the community in the center, but then it will engage all of the stakeholders, all of those players who are part of that territory. That include our funders, our financial partners, the public sector as well, when we look at health, public health, as well as territory associations. Grassroots associations are crucial for that effort, just as associations which are not located in the territory, but then they have some kind of history in that on those sites. Also, the academy, which plays a crucial role of democratizing that type of knowledge, both for the community and for the purposes of taking that to the government officials. So the academy plays this consultation role with the community. So working with local association is a part and parcel of the territories which have precarious community bases. We have obviously been able to notice that social networks were going through narrative disputes during the COVID pandemic. So the main methods for communication the community found were first the way they communicated across the territory. So in order to talk about health with people at home and their household, and with social communities that were full of disinformation. So we had this record of 36,000 people vaccinated in a matter of 4 days during our community communication actions. That was totally planned between our team and the health community agents, local agents in the territory. If we follow along the lines of multiple communication actions, dissemination and democratization of information are crucial elements, because putting a working plan together, developing the research together, but also how we could disseminate that information, how we could disseminate the research results. So this effort was implemented with the territories communication team, as well as our research communication teams and the community health agents in the Favela da Maré. So we have some reports. Fiocruz starts a project to fight COVID-19 in Rio de Janeiro communities. And here we have some headlines showing how successful this community engagement project was successful. And on the right-hand side of the image, we see some pamphlets and some other communication means that we found and developed and implemented during the study. another effort, which is not urban, that's held in the south of Brazilian Amazon in the indigenous territory of Xingu, which comprises 6 different indigenous people. That territory involves 10,000 people, and the size can be compared, the size of the territory can be compared to Belgium. So that's a green island that's surrounded by deforestation and by large agribusiness farms, which are focused on Brazilian agro-exports. So we started to be active in this territory after the COVID-19 pandemic. We were invited for a community assembly in 2021, at the end of the year. After some extremely important leaderships were lost, because they were both knowledgeable and also very active in the local politics. So they were long-standing leaderships who supported and sustained those people's politics. So with our efforts at the Favela da Maré, we were invited to restructure the health system, which was kind of failing during the COVID-19, and eventually had to put up with lots of losses. Brazilian indigenous health, according to the Brazilian Constitution, according to how the indigenous health secretary was put together, they have extremely relevant elements during the indigenous movements. But in practice, those rights are not really enforced. So indigenous health agents were created. They would be individuals coming out of each village or of each community, and they would be like a bridge between their community and their indigenous medicine knowledge and the public health service with the biomedical knowledge. So there would be the crucial basis for this differentiated health policy, as we say here in Brazil, for which would be policy for all, considering the different peculiarities of each case, taking into account local knowledge to this health system. But as of lately, given the public health investments as well as environmental issues and the people, this health strategy was kind of dispersed, and biomedicine was not counted as hierarchically superior, and the role of these health indigenous agents, this protagonist role, was reduced during the pandemic, and that was very deceptive. So there was community listening efforts after the pandemic, and then we actually followed some ethical protocols from the community, which would involve all of the consultation processes of how we should be working on. Based on that listening effort, we wrote an academic project to seek funding. We took that to the chiefs of those 16 peoples and to the health indigenous agents, and they found which elements had to be changed. We did change them after consensus of all of the attendees, and after that we started looking for funding. This project is now ongoing. This photo shows a dialogue between the Fiocruz and the Xingu indigenous community, the community-based association. This was the conversation with the heads of indigenous heads of peoples, and this was the conversation with the local health ministry, because they have a decentralized service in the Brazilian system. And here, another conversation with indigenous health agents. All of them, all of those players were contributing to the construction and to the implementation of that research, and all of the steps which are conducted together with the indigenous health agents and come to a conclusion. We share that to all of the stakeholders who put this research together with us.
The traditional healers, or as we call them, the pajés, shamans, these people who take care of the plants, the midwives, they were completely absent from the single health system. And now, with this project, we are seeking an intersection in a more diverse and different approach in order to include these people who are essential for the healthcare in these territories, but are not part of the formal public health system, as well as the indigenous health agents. These are some pictures of community communication actions, how these indigenous actors would approach biomedicine within their territories. They proposed that it would be best done through visual means. So we conducted some community communication workshops which addressed biomedicine. The visual identity was also very important. We created this for every actor involved, especially for the indigenous health agents, the feeling of belongingness and being part of a single team. This research team is made up of several people. This is the Fiocruz logo with an indigenous drawing around it. This was created by an indigenous artist. The monitoring of social media was also a part of it. The ascension of the protagonism by these indigenous health agents had reverberation in the validity of their work. This became very perceptible in social media. We did in-person listening workshops. We monitored the reactions in social media. And lastly, also, as I had mentioned before, a community feedback for all the actors involved. Of course, part of the team will not require that feedback because they are constantly a part of the project, but there are government bodies which are connected to indigenous peoples, indigenous associations which are not part of the entire process, but are our partners. So at every stage, not just at the end, we need to provide feedback to them. And something that I've heard from an indigenous health agent asking a doctor who was non-indigenous, they had just arrived, they asked, how can you care for people that you don't know? So community engagement for health means to establish partnerships through community engagement from the earliest stages. Health is life for them. And in these territories, this is a much stronger factor than in other places. They see health as territory, as life, as well-being in general. Also as relationships. So engagement has a lot to do with relationships as health. How can being together contribute to health? So the picture of the left was a time in which the root specialist, a specialist in root-based plants, was showing me how I could cure my fever in that territory. So that dialogue, that living together is part of health for them. So this was my presentation. These are a few keywords related to the subject, keywords that could direct the studies of people who are starting out in community engagement studies. So building bonds, building trust, building affectionate relationships, cultural sensitivities, constant feedback, ongoing training, listening and learning. We have to learn a lot while we research together. Thank you. Thank you so much, Giorgio, for your presentation. It was very illustrative, very interesting. It's very good how we can observe the Amazon region sharing so many common aspects with Colombia, and how these communities have various strategies that can be implemented in public health and interacting with other groups. So now let's move to a Q&A. You may now open your cams. We're going to have a final session for a Q&A.
Perfecto. Y ya tenemos preguntas escritas en la sección de preguntas y
You can
respuestas.
also turn on your
Seguiré
mics
leyendo
and
y
your
diciendo para qué están
cameras.
destinadas, para que puedan responderlas. ¿Les parece
So I'm
bien?
going to read a few questions and direct them to the speaker that
Primero, una
the
pregunta
question was directed to.
de Natalie,
All right, the first
que
one
pregunta
among the ones
para
that
el
we
profesor
have,
Fabián,
one is from Natalie.
de cómo gestionaron los
Question
aspectos
to
éticos
Professor
que involucran a
Fabian.
niños en el mini diplomado.
How do you manage
Gracias, sí,
ethical projects in these
este es un
training
asunto.
courses?
¿Me escuchan? Sí.
Sí.
You
Un
can
elemento
hear me?
central y muy importante
Yes.
de la investigación. La respuesta técnica y concreta sería que
The technical
nosotros
responses are also very
avanzamos en
important.
este proceso de aval ético partiendo primero de un aval colectivo.
The collective
Comenzamos
action
la
is
discusión
incredibly important.
donde hablamos de los beneficios, de los riesgos.
We always talk about the
Por ejemplo, en
benefits,
una sesión inicial del diplomado y bueno, y en
an
escuelas
initial training
superiores, pero en
session
particular para el mini
in which
diplomado,
we
la primera sesión
talk
hablamos
about
sobre
the
este asunto de la
entirety of the training
participación de
and the
los niños
structure of the
y se
participation of the
discutió
young
sobre
children
esos beneficios. Lo siguiente
and discuss the
técnico es,
benefits.
claro, obtener consentimiento
The technical
informado de los
objective is
padres
to
y
arrive at a consensus
asentimiento para
and
los niños
consent,
mayores.
actually,
Pero esto es,
from
digamos, lo
the
técnico. Yo diría
elderly
que lo
people.
fundamental, además, es una actitud diferente alrededor de cómo entendemos la relación, además,
This is a very
entre
different
el
approach in terms of
conocimiento
how
científico y
we
el conocimiento
acquire scientific knowledge
de las comunidades
and
y
community
una
knowledge, really.
posición donde entendemos que lo que promovemos es un diálogo de saberes entre
And what we do is promote a dialogue,
conocimientos
an exchange of
de
knowledge,
diferentes fuentes. Y desde ese
and it
punto
comes
de
from
vista,
various
pues
sources.
con una posición de respeto total
And starting
por
off with that
la
basis of
participación y el
total
conocimiento de
respect
cada uno
for
de
their
los actores,
participation and
pues
for their
generamos
knowledge,
nuestros avales.
we have been conducting that work.
Muchísimas gracias, profesor Fabián.
Thank you, Professor.
Ahora tengo una segunda pregunta también para usted y
A
para
second
Giorgio.
question to you and
Y es,
Giorgio.
¿cómo determinaron y qué aspectos éticos tuvieron en cuenta para
Which
determinar la
ethical
coautoría de los
aspects were
productos de
chosen and
conocimiento
how were they
generados en el
chosen
proyecto de manera
in
participativa?
order to determine the co-authorship of the knowledge projects generated in the project in a
Giorgio, ¿quiere
precipitative
responder
manner?
o yo? Pues vuelvo y reafirmo
Well, again,
el asunto de pararnos desde un diálogo de saberes en primer lugar.
we really do have to start off based on an
El asunto
exchange of
trasciende
knowledge
más allá de la autoría, creo yo. Nosotros
that comes before the
tuvimos
authorship.
y pusimos de forma transparente con co-investigadores el presupuesto del proyecto.
We have put
Y en
the
algunos
goals of the
casos,
project
por
very
ejemplo, en
transparently,
Ecuador
and in a few
y en
cases, like in
Perú,
Ecuador and in
decidieron
Peru,
los sabedores indígenas que iban a participar en el diplomado
we've decided that the indigenous
podían,
peoples who are going to be part of the
siendo
training,
capacitadores, ser
they could
parte del
become
presupuesto
trainers
en una
themselves.
decisión que, digamos, fue muy discutida en
This was,
términos
of course,
poder
made in
decir, hey,
this decision was made in
si un
partnership
investigador
with them.
científico va a ser
Um,
remunerado por dar una capacitación, un sabedor indígena
and they can
también
also
podía tener.
generate income for
Pero
them.
lo otro es, pues sí, que las autorías son compartidas. Les hablé de esta cartilla, saberes y usos. Pues bueno, nosotros pusimos
There's also
una
this
autoría donde
knowledge
están
charter.
todas las
You
participantes,
may remember this material.
autores y además pues nuestros
Here you can see all of the participants as authors,
académica desde la
as well as our
labor
community
universitaria.
researchers. They're part of the academic
Muchísimas
community
gracias,
within
profesor
that
Fabián. Giorgio.
process.
¿Prefieren
Great.
que yo conteste en
Now,
español
Giorgio,
o en portugués?
Como gustes.
La traducción está buena,
Sí,
o sea, que funciona, vale.
sí.
Então, do ponto de vista de coautoria
so
do
in
ponto
the
de vista
perspective
mais
of
acadêmico,
co-authorship in a more
o que tem
academic sense,
acontecido é que muitas vezes,
what has been taking
quando somos
place
chamados para
is
falar
that
nas
when
universidades,
we're called
eu
into university
normalmente,
to speak,
se eu conheço pessoas que sabem muito mais do que eu do território,
if I
eu
know people that know a
aconselho
lot more about a
que ela
territory
seja
than
convidada,
myself,
que essa
I
pessoa seja
advise that
convidada.
these people are invited
Da
to
última
speak
vez,
as well.
me convidaram para falar sobre
Last
a
time I
luta
was
das mulheres
invited, it was
indígenas na saúde
to
global.
talk about
E
the
não
fight
cabe
the
a
struggle
mim
of
falar sobre aquilo,
female
porque eu sou uma
indigenous
co-coordenadora indígena,
people
a Lauera
within
é
these
do nosso
territories.
projeto ligado à saúde e
And
mulheres.
I don't think it was appropriate for
Foi
me to
quem
talk
eu
about it,
recomendei
so
que falasse
I
no meu lugar.
recommended someone to speak in my place.
Já do ponto de vista de todas as publicações, a
Also, in the
Associação Terra
perspective of
Indígena
the
Xingu
publications,
está
the Xingu Territory
colocaria como
Associations
principal parceira da
Association
investigação.
rather is the main
Porque o que eu estou
partner of
sugerindo
the
também
investigation.
é mais fácil do que colocar
That is a way
algum
to
nome, porque
institutionalize. It's
por
often
questões
easier for
da
you to
política
just
do
recommend names
território. Eles preferem que sejam
due to the territory policies, really.
Nome coletivo,
They
enquanto
prefer a
associação é mais
collective
comunitária
name,
do que
in
uma
this
outra
case,
pessoa.
a community
No caso de
association
muitas
rather
vezes.
than one person.
Eu acho que é isso, e
Um,
sempre,
that would be it, I
a
guess.
partir de um ano para cá, sempre temos coordenadores indígenas na parte
We've
da
had, I
coordenação
believe, for
da
1 year
pesquisa,
now,
e eles sempre
had
têm
indigenous
seus nomes
peoples
nas
coordinating the
publicações.
research. They are named and credited in the publications.
Muchísimas gracias, Giorgio, por tu respuesta.
Thank you,
Ahora,
Giorgio.
siguiente pregunta de Leonardo
Next
Perelis
question
para el doctor Canario. ¿En qué
to Dr.
medida el
Canario.
intercambio con la comunidad modificó el trabajo planeado
How can
por
the
los
exchange
científicos
with the
antes de ir al
community
terreno?
change the goals of a project as you go?
En el caso de la experiencia comunitaria de éticos en la comunidad, tiene que ver, digamos, lo modifica todo, porque
Yeah.
literalmente en este caso
We have always worked in
un
partnership
plan
with communities, right? So
de
we organize
resolución
all of this.
sino una idea de acercarnos a la comunidad para identificar sus problemas.
There's always this
situaciones
idea of
que
coming
puedan
closer to
tener,
communities to try to identify
intereses
what the issues are
obviamente objetivos
and
comunes.
situations that could
En
generate
ese sentido,
different
todo,
interests
va
and,
en
of course,
movimiento,
common
todo
goals.
fluye. Y en ese caso muy
All
particular,
of that
donde no
flows
existe
towards
necesariamente un
common
proyecto de
goals. It's a
investigación
very
único,
particular case. All cases really are particular
todo lo que la
cases.
comunidad plantea es acá es más que obvio que es la comunidad que dicta el cómo y el qué.
To us, it's very clear that it is the
En otra
communities who
experiencia,
must
como en el
dictate
caso
the
en
course
el caso
of any
IROT,
piece of research.
claro que sí.
In the IDO's case,
Varió
this
la experiencia
was
del
very clear
diseño
from the onset.
en el momento en el cual la comunidad dice eso está muy bien, pero no
There were points in
utilizamos
which the
tecnología
communities
Apple, por
said
ejemplo,
something was
utilizamos
fine, but
más
we weren't using the app.
entonces ya
Um,
entra una dinámica de ver cómo hacer más
so that this need for us to
cómo aumentar la
understand
usabilidad, ¿no? de la
how to
aplicación,
improve the
y ahí fue donde
usability
entró
of an
el tema
application.
antes de ir a probarlo o luego de los primeros pilotos que se hicieron con el app, entender
This
que había
affected the
como
development of the
una
pilots
funcionalidad
even.
adicional, que fuese
We
que se
needed to
cargase
further
de un
understand
modo fuera
how
de
we could
línea,
change these
offline.
throughout the
Entonces
project,
sí hubo
all of
cambios
course
a partir
based
de los
on the
contactos con la
community
comunidad.
feedback.
Cambio.
Muchísimas gracias, doctor Canario. Ahora
Thank you,
está una
Dr.
pregunta para
Canario.
todos los panelistas
Now a question
de
to
Gabriela
all the
Sandoval
panelists.
de Perú, que pregunta: ¿qué estrategias usaron para involucrar también
What
a los
strategy
medios
did
de
you use
comunicación?
to involve the
Podemos empezar por el doctor
communication
Fabián.
outlets?
Con medios de comunicación usamos más medios locales y
Well, we tend to use local outlets.
que nosotros nos movemos en un territorio rural, pero donde
These are
las
all
comunidades utilizan
mostly actually rural
el
locations,
celular de manera muy generalizada. Entonces, desde
but they do
chats
use their cell phones quite
comunitarios
widely.
hasta una página en Facebook, donde
So we
hay
have a
mensajes
Facebook
que están
page.
permanentemente alimentándose. Aquí hay que,
We're
bueno,
constantly
hay
feeding those
comunicadores
pages.
sociales en el equipo
We
que
have
procuran
social communicators
diseñar
within our
instrumentos
groups
que hagan
who
esta
try to design
traducción del
instruments that
necesario
will
de
facilitate
los
that,
conceptos
that can involve
científicos, que es
translation,
el caso, y luego,
scientific messages.
como dicen, el tiempo en televisión es corto, hay que hacer mensajes breves y que de impacto.
And as with many cases in
Hemos
social communication, these messages must be brief.
En revistas de
We have
difusión,
even written a few
lo hacemos
articles in terms of
contenido
how
académico y no en
how
revistas
this
académicas
communication
también, que son
is
de libre acceso
as effective as it can be.
Muchísimas gracias, Fabián. Doctor Julio Canario, ¿te gustaría dar una
Dr.
contribución?
Julio?
Claro que sí. Al igual que Fabián, es muy similar acá.
I agree with Fabian, and
República
the
Dominicana,
situation
también
here in the
usamos a
Dominican
los
Republic is quite
comunicadores
similar.
locales, sobre
We also
todo.
tend to use
Se
local
hace una
communicators.
convocatoria liderado también por algún miembro del equipo que conoce a la comunidad,
Also,
que
the
conoce
team
cuáles son
that
los comunicadores más
relates with the
apropiados o
community.
adecuados
What are the communicators?
para
Who are they?
participar
And
en la difusión del proyecto. Se les
who's going to
también
participate
a
in
esas
the project
reuniones en las
discussion?
cuales
So they have to be
no
welcomed in
solamente
these
con los comunicadores,
meetings,
sino donde
not
está
only with meetings with
toda la
communicators, but
comunidad
also
allí, de
involving
manera
the
tal
entire
que ellos
community.
pueden
So they
alimentarse
could,
de lo que se
so they
está
can
haciendo y
actually
tener un
feed
rol
from
directo de
what is being
comunicación.
done, and they'll have
Y
this
obviamente
direct
hay que
channel of
contemplar
communication.
en el
Obviously,
presupuesto,
will
porque
also
para
have
ellos es
to
un trabajo.
be contemplated in
No es
their
solo
budget because it's a job
voluntariado.
for them. It's not only a
Digamos,
community
voluntario, no
activity.
siempre.
It's
En
not on
algunos
a
casos sí,
voluntary
y
basis.
en
Not
otros
all. In some
casos
cases they are, but
también
then in most
contemplamos en
cases
los proyectos
we have to
que se
contemplate
haga
that
esa
in our
labor de
projects,
los
the
comunitarios
possibility of how to fund the
periodistas
community
eh,
agents. We're going to be
o que
working
están
with the
o que usan alguna
communication,
radiodifusión
or the ones who
a
will
su
use
favor y a favor de la comunidad.
local communication channel to their favor
Muchas
or
gracias,
to
doctor
the
Canario.
favor of the community.
Giorgio, si le gustaría contribuir
Professor
algo,
Canario,
pregunta.
Bueno,
thank you very
nuestro
much.
caso, se
Now,
usaba mucho el radio en los territorios indígenas
well, in our
porque
cases, we use a lot of
no tenían
radio
conexión
communication in the indigenous
la Wi-Fi.
territories because
Pero
we
ahora
did not
Internet
have
ha
communication with the
llegado
villages. But now the
hace
internet has helped us,
2 años en larga escala, así que
and in large
el
scale in the
radio
past
dejó de
2 years.
ser
So much so,
usado
the radio can
y
be
empezaron
used,
a usar el WhatsApp y
but
tienen
the WhatsApp
grupos
started
para
to be
hablar de
used.
salud
So
en
we have
WhatsApp
groups
y
to
claro,
talk
ya
about
son
health
unos
through the
cards
WhatsApp.
como
And we obviously
este
prepare these
que usaron
cards,
para invitar a la
such
gente
as the
para
ones that we
acá
use to
que se
invite people
puede
over to
compartir
this meeting.
fácilmente, así
Cards that
que
can be
enviamos
shared very easily.
para
So
algunos
we
agentes
send them
indígenas de salud y
to
para
some of the
la
indigenous
otra
health
parte del
agents
equipo médico
and to the other
y
part of the
envían en
medical
los
team.
grupos de WhatsApp
They will
sobre
then
salud.
share that through their
Y
health-related WhatsApp
en relación
groups.
a la comunicación
Also,
más
concerning
institucional,
the
nuestros
more institutional
parceros como las
communication,
asociaciones
partners such
locales
as the local
y el
associations
servicio
and
público
the
local
public services,
también
local public
publican en
services,
sus
they also
Instagrams o redes
post that on
sociales.
their Instagram or
Muchísimas gracias,
in the
Giorgio.
other social
Ahora
media.
una siguiente pregunta
Thank
de
you,
Luciana Camel.
Giorgio. Now, a
Dice
question
que
by
le
Luciana
gustaría
Camel.
saber cómo se mide el
She would like to
impacto
know how the impact can be
involucramiento
measured
comunitario, del involucramiento de trabajo comunitario en los
of
proyectos
the
presentados.
community
Vamos a
efforts.
empezar con el
So
profesor Fabián.
could you please share that? We can start with
Gracias.
Professor
Sí,
Fabian.
es un punto bien importante.
Yes, this is very important.
Nosotros nos paramos desde visiones de procesos de
We
transición.
are
Y
looking
en
at
ese
the transition
sentido,
processes. In that
entendemos que hay
sense, we
procesos
understand
comunitarios
that there are community
que
processes
pueden medirse en términos
that
de
can be measured
relacionamiento
in terms of a relationship
entre ellos. Por eso una
amongst
estrategia
themselves. So this is
que
therefore a strategy
implementamos al principio del
that
proyecto
we
y
implement in
durante
the
el
beginning of the
proyecto
projects.
es
During the
hacer
projects,
network analysis.
we are going to develop
Entonces,
a network
con
analysis.
mediciones
So
repetidas, lo que
that
hemos
will
tratado
include
de ver es cómo se
repetitive
van
measurements. So
fortaleciendo o no
we can actually keep
redes
track
de
of how
cooperación,
that builds the
redes de
strength amongst
colaboración
those
entre
communication or
agentes
collaboration networks.
comunitarios, pero también entre
So
agentes
this through this
comunitarios
collaboration between community
institucionales,
agents, but also institutional
tanto por
agents,
compartir información o el
both in
desarrollo
terms
ya
of
de
sharing
actividades
information
conjuntas.
or developing joint
Em,
activities.
Un asunto que es más difícil de medir es la construcción de
Another topic
confianza,
which
que
is
yo creo que sería un
less,
asunto que deberíamos
it's more difficult to
medir.
build, which is the development of trust.
Muchas gracias, profesor Fabián. Doctor Julio
Thank you,
Canario,
Professor Fabian.
¿quiere continuar?
Professor Julio Canario,
Gracias por
so
la
please
pregunta,
take the
muy
floor. Thank you very
importante
much for the question. It's a very
y
important one
difícil a la
indeed.
vez. Pues muchas veces los proyectos no
It may be
previenen,
difficult at
no
times
en su
because projects
esquema,
do not
un planteamiento
include
claro de
any clear approach to the impact of the social engagement activity. So in general terms, I think that could be considered a failure. We can measure results such as the number of meetings that were held, the dialogues that have been implemented, who were the participants, how representative the dialogue has been all along, since there is this and that participation. So that analysis is also looking at the greater influence that has been implemented, also being able to map the analysis. So mapping the players, that will provide another way to analyze how to communicate and when to communicate, and also the impact of the specific experiences of each project.
Fue desbordante. Justamente la estrategia de involucramiento comunitario fue desbordante.
This strategy of community engagement has actually been able to go beyond the original objectives of the studies. So as soon as we engage the community, we have to accept that things can vary, and in a far-reaching horizon of the impact, but also we are to be looking at the short and long-term results. So the research outcomes can be taken to the public realm, because basically, in this case, we will be able to work actively on the results of the investigation. That can be done quantitatively or qualitatively. So it has to do with the sort of predictions of how we're going to be measuring that in an adequate manner, according to the research question and the reach we want to achieve across the community. Thank you very much, Giorgio. You have the floor now. Since Luciana asked a question from Brazil, I'm going to be answering that in Portuguese. Indeed, it is a difficult theme, because I think from the viewpoint of measuring for potential funders, for instance, this measurement has to be related to, as Julio mentioned, in terms of the number of meetings that were held, the number of community collective activities. But then I think, mostly for us who are directly involved with the effort, I think it has to do with the level of satisfaction of being part of it, meaning those people who are doing that together. And one thing I included in my presentation was the aspect of monitoring participant social media. We see that since our project has to do with reviving the protagonism of community health agents, the indigenous health agents, it has to do with their performance. So the difference between the focal points and the conversations that were held before the project concerning some intercultural conflicts on the part of the health team, because there are some people who are not community members, but they are working that on behalf of the public services. So the level of conflict amongst people, both before and after, this is also a term of measurement of how community engagement has enabled the communication and the efficiency of that effort in a territorial situation. Also, given the vaccination data, which I mentioned, the Favela da Maré data, this is also one way in which we can monitor. After some community communication based on community engagement, after that, we could observe that there was a peak in vaccination. I think this is too one way in which we can measure the impact of our community engagement efforts.
Ahora aquí una
Thank you very
última
much,
pregunta
Giorgio, for your question,
de
for your answer.
Derban,
Now, another question
de
is
África,
coming from Derbasi from
que pregunta
Africa. The question is,
¿cuáles son las barreras o
what
dificultades
are the
específicas
barriers or the
enfrentadas por cada
challenges
país en
that
este
each
proceso
country has
de participación
faced
social?
in this process of
Naturalmente una
social
pregunta que amerita su
engagement?
propio webinario, por lo tanto
This
puedo pedirles
question
que me
is
lancen uno o dos ejemplos, tal
very
vez
broad in
concretos,
terms
de
of
dificultades
this
que enfrentan este proceso.
webinar. So I'm going to ask each one of you to
Profesor
share
Fabián.
some specific
Bueno,
examples. So perhaps Professor Fabian could
brevemente, sí.
start.
Lo primero, pues nosotros ese
Indeed,
proyecto lo estamos haciendo en un territorio en conflicto.
since this
Como ya
project is being
mencionaba,
conducted in a conflict
los procesos de
territory, as
violencia
was
en Colombia
mentioned,
por el conflicto
there's a
armado
lot of violence,
desafortunadamente
armed
no
conflicts in
cesan.
Colombia.
Entonces, el solo
So
desplazamiento,
unfortunately,
tenemos líderes y
that
lideresas
involves
amenazados
displacement. There's
y el
also
solo
leaderships who are
desplazamiento
being
del equipo de
threatened.
investigación en ocasiones es
Also,
complejo.
what affects the investigation
Y
team
lo
that
segundo que yo
makes
mencionaría
for
sería
the
la incidencia
complexity of this
política.
issue. The second thing
Ahorita un
I'd
poco
like to
en
mention is the
relación con lo que
political
Giorgio mencionaba
um,
antes,
scenario, as
estas son
Georgia was
organizaciones
mentioning
comunitarias que
before.
tienen agendas
They
políticas
are
y
they
en
are
ocasiones entran en
community
conflicto
uh,
con las administraciones
agencies that have
departamentales o municipales.
difficult
Entonces,
agendas which may
lograr
be
ese
in
diálogo
conflict with
con los
the
actores estatales a
local
veces no es
officials.
sencillo.
So engaging
Nosotros lo
this
hemos resuelto
these
generando
two
procesos de
agents
empoderamiento
uh,
con las
that may
comunidades
be
alrededor
subjected to
de
conflicts.
monitoreo,
So
seguimiento, veeduría
monitoring
ciudadana
the
a los procesos
follow-up and the
digamos, de
citizenship
planeación y
involvement
desarrollo departamental y favoreciendo algunos canales de
that
comunicación entre
may
organizaciones
favor
y
some
el
of the
Estado a
communication
pesar,
channels,
digamos, de las dificultades que hay en la comunicación.
despite the difficulties in what
Gracias, doctor
concerns
Fabián,
the
por
participation,
su
despite
respuesta.
the
Ahora,
communication
Julio Canario.
difficulties. So thank you, Dr. Fabian, for
Sí,
your answer.
en nuestro caso y similarmente
And Dr.
igual al
Julio,
caso en
in our
Colombia,
case,
como
very similar
menciona
to
Fabián,
what happened in
los,
Colombia,
los
as
conflictos
Fabian mentioned,
sociales en
social
Dominicana
conflicts
tienen que ver con
and the Dominican Republic
muchas necesidades
have to do with the needs,
económicas,
both
sobre todo,
economic,
¿no?
particularly
Pobreza, falta de
uh,
organización
the
social
issue of
y
poverty and
obviamente
the scarce social organization.
generalmente el estudio no plantea
So the
ir
studies do not
necesariamente a
pose that.
una organización a un macro
So
eh,
our organization at
o
the
meso nivel, ¿no?
macro
Tienen que ser
level
generalmente por las cuestiones
in the
del
beginning,
alcance
so
del
it has to
proyecto,
be
van a temas
looking at
muy
the reach of the
específicos.
project. They are very
Y esto se
specific themes indeed,
conjuga
and
con
this
malos entendidos de lo que es la
is
investigación y qué es lo que se
added by
propone
the
hacer,
misunderstanding of
que en
what the
muchos casos
investigation is
la
all about, the research
investigación le
efforts all
propone
about, and
soluciones
that may be
directas
confusing
a
at
los
times,
problemas que tiene la
and they
gente
may
en el
be
barrio,
proposing
sino
solutions
que
to
van
the
por alguna ruta
local
donde hay
problems,
que
and
buscar
they may follow some
directamente
kind
las
of
personas que
route
hagan el
in
beneficio
which they will
de la
be
investigación para sus propias
looking at
vidas
the
y sus
difficult
propias
part of the
comunidades. Y allí se
uh,
pueden crear
investigation,
falsas expectativas
and that may
y al
generate false
inicio, sobre todo,
expectations
si
in the
esto no
beginning,
se
particularly.
trabaja y no se comunica
So,
de forma adecuada,
if we do
puede
not
traer problemas
communicate in an
mayores.
adequate manner, so
Así
that
que
may
por eso la
generate
necesidad de la
bigger problems. This is
participación
why
social en la
there is
investigación,
need
porque
for
justamente es el
community
intento
engagement for any research effort, because
atender
this is the
ese tipo
intention,
de
which is
situaciones.
to
Y
reach
pueden darse
uh,
casos,
to
asimismo, de
these
conflictos de
populations
interés
and
entre miembros de la comunidad que tienen
serve
algún
this kind of
deseo
situation. So we have to
personal
be
de
looking at the
progresar
community
también,
desires to
quizás a modo de una
to
institución también que está
engage
ya
also
vigente,
some
y hay que ver
institution
cómo
that
se
is
equilibra el tema de la
involved. So we
equidad
have to
de
look
cualquier
at
beneficio que
this,
pueda
how
tener
we can actually strike a
la
balance
comunidad
between all
y
of
que no
the
haya una
agencies,
apropiación en la propia
and there
comunidad de
should be
pequeños
no
grupos que
appropriation of
están
the
quizá
small groups of the
gestionando
community,
a
which
veces el
will be
beneficio de todos, pero la
resonating
comunidad
that
no
in
necesariamente
benefits
ha
of
dado su
everybody,
permiso
but
de
then the
aprobación a este
community
tipo de
will
actividades.
not
Así que
be
allí hay
providing
mucho
their
que ver
approval to this type of
también las
activity. So
dinámicas
we also have
al
to
interno de
consider
la
the
comunidad.
different dynamics
Dinámicas
inside the
puedo
community, the
referirme a
power dynamics.
de
That's
la
what I am
comunidad.
referring to.
Gracias, doctor Canario. Giorgio.
Thank you, Dr. Canario. Giorgio,
Sim,
please.
eu acho que eu vou um pouco na linha dos
I
meus
think I will
colegas. Acho que
sort of follow the line
a
of
gente
my
tem
previous
algumas questões, por exemplo,
speakers, my two
quando
colleagues. There are issues,
o Fabian
particularly when
comentou
I think Fabian mentioned low female participation in some training efforts. So there were or there are conflicts of interest, which are internal to the communities. To this community approach is not always easy to include all of the different interests. For instance, there's an interest of women's movements within the territory and a more general health movement, which is more focused on men.
Como fazer para ter maior participação das mulheres nesse caso? O Fabian, por exemplo, mostrou uma saída
So Fabian showed
muito parecido com o nosso caso. Bom,
a very similar approach to our own. Where are these women who are not participating in these actions? How to bring them in along with the children, just like Fabian mentioned. So in our case, we're currently building a few dialogue spaces, and we are personally inviting the women in order for them to attend. This is a demand from the women. They have some difficulties accessing these spaces traditionally, and there are some internal struggles there. That is why we have been starting to find these community-based approaches. We mentioned the communities in our papers and research. In the Xingu territory, for example, it doesn't really work. So we started thinking about providing studies and investigation scholarships to a few people. They decided to remove that from the project and prefer that we organize more community events and use that resource to pay for the work of some people, because some people were not being paid. So there are many changes that arise from dialogue, the presence or absence of consensus. And a second point is community engagement dialogue is very strong in the territory, but we also need to focus on the health services alongside it. That bottom-up approach is a bit more rigid. It's a bit more difficult to bring health services alongside the rest of the work. Bringing those dynamics to them, to present to the government a form of management that's more community-based. Because we need to do it in partnership with them. Like Fabian said, there are political issues, community demands towards the government that influence that. So how can we get all of the agents from civil society, from the communities, from the government, and in the same page or even on the same table? That's very hard to do while you are trying to invest the health sector. These are some of the challenges. Thank you so much for your intervention. Thank you, Giorgio. Unfortunately, we've reached the end of our event. It's been excellent. There were great presentations, very good contributions from the audience as well. It shows that community engagement is very alive in Latin America and the Caribbean. Thank you so much for the panelists for their participation. Thank you to those who have accessed the webinar and have stuck around to the end. We will continue the conversation, of course, and continue to hold more in the future. There are some more dialogues scheduled for this month, I believe. If you wish to be part of MESH, you are always welcome. If you wish to be part of our project, also you are always welcome. We are always accepting contributions that promote community engagement. Once again, thank you. See you soon. Stay in touch.